current research has associated mental health, in this case depression, and muscle strength, specifically hand grip strength. Hi everybody, my name is Margarida Gaspar de Matos. I'm a chartered clinical and health psychologist and a full professor at Faculty of Human Kinetics and Medical School, the NVL Center, University of Lisbon, Portugal. I am a senior member and team leader. The first author and the mentor of this paper is Dr. Adilson Marques, a young and promising researcher who works at the same institution as me. The other authors came from 4 other institutions and 3 different countries. Half of us are psychologists, clinicians, and researchers, and half of us are physical activity experts. All of us are experts in public health. The title of our publication is Grip Strength and Depression Symptoms Among Middle-aged and Older Adults, and it will appear in Mayo Clinic's Proceedings in October 2020. It is known that throughout the aging process, there is a decrease in physical functioning and muscular strength. This decline is associated with lower muscle mass and reduces strength, balance, coordination, and flexibility that contribute to increasing disability, frailty, and falls. Lower muscular strength is also related to mental health issues such as depressive symptoms. The current study aims to analyze the relationship between hand grip strength and symptoms of depression, considering sex and age in older adults from 18 countries. Our study used cross-sectional data from adults aged 50 years and older. From the survey Health, Aging and Retirement in Europe, Wave 6, the SHARE study. Hand grip strength was measured using a hand grip dynamometer. The EuroD 12-item scales was used to assess depressive symptoms. Multivariate logistical regression analyses were conducted. As for results, hand grip strength was negatively associated with depressive symptoms. Regardless of age and sex, individuals who were in the upper quartiles of hand grip strength, those who had more hand grip strength, were less likely to have depressive symptoms than those who were in the lowest quartile, those who had less hand grip strength. There was a steady negative association between hand grip strength and depressive symptoms, regardless of age and sex. Well, is it that non-depressive patients are more autonomous, feel more confident, feel safer, and feel better, being thus more motivated and more active, developing more muscular strength? Or is it that those who have more muscular strength feel better, are more autonomous, are more active, more motivated, feel safer, feel more confident, being thus less frequently depressed? We do need to understand better the direction and processes involved in this association in order to be able to better prescribe preventive and clinical interventions. Mayo Clinics includes the Mayo Clinical Depression Center. This center includes an outpatient program that provides, among others, treatment to depression. We have never collaborated with Mayo Clinical before, but it occurs to my mind 3 common concepts that fit perfectly in both missions: multidisciplinary, multicultural, and translational. That is, translating research into clinical practice and vice versa, using diverse expertise and life contexts. I believe that the Mayo Clinical Depression Center would be our perfect partner for our next clinical trial, making it a multicentric international clinical study. Health and clinical professionals are urged to identify problems regarding low muscular strength among their patients, together with their levels of depression. Assessing adults' hand grip strengths can be used for screening for physical and mental health and well-being. Our research suggests an increased attention to a new screening device, the hand grip dynamometer, and new preventing and clinical interventions, specifically focusing on increasing muscular strength. Regarding patients, physical activity is in general recommended in order to increase an active daily life, in order to increase autonomy, socialization, and well-being. This specific product of physical activity, the muscular strength, is now surfacing, allowing a safer physical and psychological activity and well-being, decreasing falls and accidents that are often disabling at those ages. Well, not only for patients, but for everybody, especially after their 50s. 3 lines of research are planned for the next couple of years. First, a systematic review focusing on biochemical processes involved in muscular strength and in depression that will help to build a theoretical framework. Second, a clinical trial in hospital setting controlling for types of depression and age of onset of depression. During this clinical trial, pre, post, and follow-up measure will be collected on biomarkers and depressive symptoms, before and after 3 conditions. 1 intervention promoting physical activity in general, 1 intervention promoting specifically muscular strength, and a waiting list group. This will be a sophisticated mixed method study that will allow a better understanding of the direction and processes involved. We also aim to propose a large-scale populational study, including a component of strength training within a general physical activity program among older adults, individuals. It will also be a sophisticated research design that will hopefully influence public policies regarding physical and mental health and well-being in older age groups. Do not miss our paper at Mayo Clinical Proceedings, and do follow up our future research. Thank you.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.